Hello everyone, Dr. Christine Smith back with a great interview for you today with Dr. Jennifer Rowlands, and she's a double board certified OBGYN specializing in integrative care. And I think it is so invaluable to talk to docs who have an understanding of our conventional system and also the system that we're hoping healthcare is kind of moving towards, which is the functional model, which is really taking, everyone's entire life into account. Balancing hormones and how it can actually contribute to cardiovascular health as a really big component of health overall. And I think this is super important to understand for a majority of people because more people struggle with it than we realize. So hello, Dr. Rowlands. Thank you so much for taking the time to do this today. How are you?
I'm great. How are you?
I'm wonderful, thank you. I was just telling everyone a little bit about you and that you're a double board certified OBGYN who also specializes in integrative health, which I think is so needed right now. So I'd love if you could just introduce yourself a little bit and tell everyone how you kind of fell in love with this niche of really helping women to understand their bodies and how cardiovascular health is so tied into our hormonal balance. And, even though we're talking about women today, the cardiovascular hormonal thing kind of goes for guys too. Like we all have the same hormones, just in different levels. So I think this is important for everyone.
Yeah, so I think most of us in this space end up in it because of our own personal journeys. And about 14 years ago, I was struggling with infertility. I couldn't get pregnant. I'm an OBGYN, right? Like I should know all this information. I should know what to do to fix myself. And unfortunately, I could not get pregnant and tried all the things that all did all the labs and did the workup and kind of went that direction. And I kind of in my heart felt like, I think I have PCOS. Like I don't fit the typical model. But I certainly had irregular cycles and I certainly had some acne but I didn't have weight issues and I didn't have this sort of testosterone effects that a lot of people sort of notice. And I kind of pushed my OBGYN that was taking care of me to get blood work, and I had a testosterone of 80.
Whoa.
So my testosterone was super high. Clearly, I had lean PCOS, or, there's different ways we categorize, depends if we're talking about traditional medicine, alternative medicine. And so with my own journey, realizing, that there's more than just sort of this in the box kind of answers for people. So I was able to conceive that child. And then afterwards, I ended up being diagnosed with Hashimoto's. And weirdly, again, labs were, my TSH was normal, but my thyroid antibodies were super high. And so as a doctor, I'm sitting here going, okay, I'm taking Synthroid, I'm taking a birth control pill, I'm taking everything the doctor tells me to do, but I felt terrible. I was exhausted. I was drinking 4 to 5 cups a day. My hair was falling out. I just didn't feel good. And so it really made me kind of dive into other aspects of what we don't know in medicine. We don't get taught nutrition at all. I mean, I'm sure you have a million doctors on this show that tell you that we get a month of nutrition, which is probably being very generous.
Yeah. I mean, I even got more nutrition education in my schooling background than technically the conventional system gives, and even ours was very sparse.
Yeah, yeah. I mean, nothing about nutrition and really nothing about, well, what do you do with the person like me who's still miserable despite taking Synthroid and all those things? So it kind of, my own journey made me kind of have to do this for patients and realize there's definitely more than just treatment, diagnosis, here's the treatment. Here's a disease, here's the treatment. That's kind of what Western medicine is really about is waiting until there's a diagnosis, then we give you medication, and then most of the time you're on that lifelong. Instead of trying to figure out how do we reverse those conditions, how do we actually work on trying to allow someone to heal their own body and maybe potentially not have to be on medication. So it really is, for me, it was a personal journey. And as more I learned, the more patients I was able to help. In fact, at the same time, I had a patient of mine who I'd had for a long time who was struggling with infertility. And she went to her REI doctor who told her, well, you just need to lose weight and everything will go great if you just lose weight. She also had PCOS. And so she came to me very frustrated and upset. And I also was, what I was learning was teaching her as well, saying, hey, if you do this, you need to get your blood sugar checked. You actually need to have these things done. And her and I were kind of going through this infertility journey together. And ultimately, she ended up conceiving 2 children naturally in the 15 years that I took care of her. And so, it was a matter of my own personal journey, but also patients that I was hearing the same thing I was feeling, which was my labs are normal, but I don't feel normal. So now what? So it kind of was this personal effect that kind of pushed me that direction. But I ended up doing the Andrew Weil 2-year fellowship and being now board certified in integrative medicine and also doing functional medicine training. So I kind of describe to patients, I just have a lot of tools in my toolbox, depending on what we need to do. And so it's really about patient's choice and what works for them.
Oh, I love that. And I love the Weil Institute. They have so many good foundational concepts around functional and integrative medicine. And, so if any practitioners are watching this, like that's a really good place to go and learn. But there's a couple of things that came to mind just as you were talking, where it's like we get put on all these different medications in an effort to balance, and they push different systems. But for instance, like with, you said that you're drinking like 5 cups of coffee a day while on thyroid medication. The component of that is like the thyroid is like the energy manager. It sends out all the signals. But if the factory that produces the energy can't work while it's receiving the signals, which is our mitochondria, then those signals only go so far. Or if we're really having to push our adrenals, which is I kind of consider like our reserve gas tank, while we're trying to manage the thyroid, then the adrenals get depleted. So then our reserves get depleted, and then we end up in this terrible position. And then with our adrenals depleted, it affects our sex hormones. So I'm sure we'll dive into all of that very shortly. But I wanted to dive in first with like, let's just discuss a little bit about the metabolic health effect on hormones. And when we say metabolic, we're talking about, blood sugar and how your body manages energy and how we process our nutrients to use it for energy and those pieces. Because generally this physiology dysfunction is the beginning of our hormone dysfunction. And if we can catch it early, we can prevent the hormone dysfunction. And I like that you mentioned like you weren't a classic case of PCOS, because for anyone who isn't familiar, PCOS is polycystic ovary syndrome. And not everyone gets cysts in the ovaries. Sometimes it's more of a blood sugar and a testosterone thing, and you can be, like you said, lean and have it. It doesn't always mean that you're overweight. So I'd love if you would just dive into that and like some of the things that you really commonly see as dysfunction in your work as like the beginning stages before all this stuff starts cascading down a pathway that becomes harder to recover on the hormonal side.
Yeah, so PCOS is a perfect example, but I'll just say sort of across the board, all my patients, I ask more questions than a typical doctor. I always ask, do you have regular bowel movements? Do you have bloating? Do you have GI symptoms? Like, do you have mood issues? If they tell me they have bloating, gas issues, and anxiety, I'm like, ding, 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 gut, 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 gut. Like it just, so I ask questions that probably are not, or I know they're not standard questions because I know that because I see patients who come to me and go, no one's ever asked me that if I have bowel movements. I'm like, well, welcome to integrative medicine. Like this is important. It's the whole body. So I need to know all the systems and what this is about. So I would say for across the board for my patients, I'm always asking them about sleep, about gut issues, about stress, not just, stress now, but stress that could have happened prior, some stress that our body holds and therefore is, when we talk about thyroid and these chronic issues, how much that is playing into your ability to heal. Relationships. I mean, you can, perimenopause patients are a perfect example. I a lot of times see patients who are in perimenopause and they say, well, my husband doesn't understand what I'm going through. I'm like, well, then we need to involve him in the conversation. This needs to be a relationship. So I ask sort of more broader questions related to health for all patients. But to the metabolic question, PCOS is a perfect example of where this really gets derailed because most often in medicine, we sort of think of PCOS as a reproductive problem. It's a GYN problem, it's a girl problem, a hormone issue. But it's so much more, so much more. And if you don't look at it from a metabolic standpoint, you're missing a ton of things that are not going to get better. I can't make your hormones, your estrogen, progesterone, testosterone better if you have fasting insulin problems, and if you have high cortisol. They're all interrelated. It's a symphony of hormones, like an orchestra. If I tell you, if we go to an orchestra concert together and the violin guy is like standing up doing his own thing, like you're not going to hear anybody else because you're focusing on the violin guy that's doing his thing. That doesn't make sense. So it's really kind of important, especially with PCOS, to make sure that you're looking at them from a perspective of what is their gut health like, what is their fasting blood sugars or their blood sugar regulation, what is their testosterone level, what is their cortisol. So you want to look at all of those factors in order to truly treat someone with PCOS, because in their lifetime, it's going to change all the time. They may have blood sugar balance problems in their 20s, and then voila, they hit perimenopause, and now they have inflammation issues, and their CRP is out of control, which is really pretty common picture. So it's important to make sure that we are always addressing all of those aspects of metabolic health when we're talking about someone with PCOS, for example. But that example could also be used in perimenopause or menopause. I see patients who are in menopause who, we restore their hormones, give them bioidentical HRT, but still they're gaining weight, but still they're having hair loss, but still they're having horrible anxiety, because we also didn't look at that from a metabolic standpoint too. How does restoring estrogen, progesterone, testosterone affect their blood sugar? How much does it affect their cortisol? How much does it affect the, ghrelin-leptin connection? Like, there's so many more things that all interchange. So it's really important to always look at these things from a metabolic lens anyway when we're talking about hormones. It's not just one.
Oh, I could not agree with you more. I'd also love if you could explain for anyone who's like less familiar about, some of the hormones that we just mentioned and kind of how they interplay with each other. Because like for, example, the reason that we're talking about gut health so much is one, it's, how you process your nutrients, but it's also how you detox your hormones. And so all of a sudden, if you're constipated and you're unable to detox your system, you can actually have something called like beta glucuronidase, which is a component of your microbiome, and it can unconjugate hormones, and then you accidentally get them back in your bloodstream, and that can be an issue. And so you're actually recycling and getting hormones back in your body that you're supposed to excrete. Or if you're really pushing on your adrenals, our adrenals actually have a layer to them that help with some of our testosterone maintenance and some of our hormone maintenance. And so then all of a sudden it's getting disrupted there. But yeah, just if you could lay out kind of maybe how you explain for your patients sometimes this symphony of these things and how they kind of feed into each other, just because I love educating people how their bodies work. I love that.
Yeah, so let's just pick estrogen because that's the easiest one to sort of talk about. First of all, there's an estrogen receptor on every cell of your body. So estrogen is critical in everything that we do. And this is why if you look at the symptoms associated with menopause, when people lose estrogen, joint pain, itchy ears, skin changes, hair falling out, blood sugar problems, cholesterol problems. I mean, you can just go on down the line. So, because there's an estrogen receptor on every cell in our body. And so how I explain to patients is I say, well, we need to make estrogen, we need to use estrogen, then we need to lose estrogen. So we need to make it. Our ovaries typically are the predominant source for making estrogen. We do sometimes have conversion of testosterone to estrogen in peripheral tissues, but the majority is made from our ovaries. And then we need to use it for all our parts of the body, brain, everywhere, especially our brain. Our brain loves estrogen. And then we need to lose it. And we lose it through that metabolism that you were talking about. And so those obviously involve the liver for part of that metabolism, and then the gut. So you need to actually add a water group to an OH group to, go ahead.
I was going to say, I'd love to tie into because I saw a few comments coming in and someone said, like, just detox the liver, which, yes, but there's a way to do these right and in the right order. So I'd love if we could touch on that a little.
Yeah. So you're talking about phase 1 and phase 2 kind of detox.
Yeah, so just what you're already talking about, but just wanted to mention that comment that came in because I thought it was important.
Yeah. So we need the liver. We need the liver to actually create, to take estrogen and make it into a molecule that's actually water soluble. So then it could be excreted either in urine or waste, poop. And so mostly poop. And so if you don't, one thing that I love, I don't know if you probably follow Carrie Jones, but she has a great analogy of the bathtub, which is a fantastic way to explain it. Because really, if you plug up the bathtub, it doesn't matter what all the water and the shower head and everything else coming through, like the plug is the problem. So if we have constipation and we don't have our bowels moving and getting rid of waste products, kind of the other phases, while they're important, are not as important because we got to get the stuff out. So, you add that water group and then you actually get rid of it through waste, but 80% should really be get wasted or leave, and then some is recycled back in and used as part of our our estrogen that's essentially free. But if you have constipation and your bowels are slow and not really moving, then you can imagine that you're not getting rid of the waste that you need to, and for lack of a better word, you're recycling crappy estrogen that ultimately ends up hurting you because the body says, oh, we have estrogen around. It's all good, but it's not the kind of estrogen that you really want to sort of be using. So it is a big factor, gut health, if you have you don't have good estrogen metabolism. But the other important part is, remember, a lot of our neurotransmitters for our brain are made in our gut. And we need estrogen for those. You have to have estrogen to make appropriate serotonin, dopamine, norepinephrine. 70% of serotonin is made in the gut. So if you really have poor estrogen metabolism, you're also affecting those neurotransmitters, which is why a lot of times you see people with PMDD have mood and gut issues. PCOS have mood and gut issues. Perimenopause, menopause have gut and mood issues. Gut and mood issues, like, because it's oftentimes related also to the status of the gut when we talk about those metabolisms. So it's critical, and those are just two. We can talk about insulin, certainly is a factor if you don't have estrogen. This is how I describe, if you have, is it okay for me to sort of describe how, okay.
Oh, absolutely.
This is how I describe the three big ones: estrogen, progesterone, testosterone. So they're three sisters. So estrogen's the number one sister, the first sister. She's the one in control. She's the dominant one. She's the one that sets the pace. She typically is the bossy, organized one. She's involved in everybody's business. Like, she is like the older sister that kind of sets the tone. Progesterone's the middle sister that often kind of gets ignored. She kind of gets displaced, but she's equally important. She complements her older sister. She's often the calmer one, the one that sort of, kind of follows in line without the sister, but she can wreak havoc if she wants to wreak havoc if she's being ignored too much. Low progesterone can cause all kinds of terrible side effects. And then testosterone's kind of the one that beats to its own drum, the little sister. Typically, she can also be, in charge and essentially kind of boss the other ones around. But also can be doing her own thing. There are people who certainly have testosterone that's affected by their adrenals, testosterone that's affected by blood sugar, right? They can have other components, other hormones that sort of play into how well testosterone works in males and females, both. So when you talk about sort of those in that combination, they all kind of have to be in harmony. When you have one sister that's still a little out of control, then oftentimes it kind of trickles down to the other ones as well as to their behavior, if that makes sense. This is why when I do HRT, I often talk about, I don't just give estrogen alone. I talk about estrogen, progesterone, testosterone, and what's missing and what needs to be restored.
Which is the responsible way to do HRT. So thank you for doing that. And, I saw a few things pop in and someone said, like, let us know how this affects men too. And like, she is an OBGYN, so we're talking mostly to women, but men, you have these hormones too. And everything that she was talking about with the liver, where it's like we have our, phase 1, which is where we kind of deactivate a toxin, then phase 2, which is where we make it water soluble, and then phase 3, where we actually excrete it through our waste. We have to go backwards to protect the liver properly. So just like she was saying, we have to get things moving first, then we can make them water soluble, and then we can transform them. Because it's like if you're putting trash out on the curb to be picked up, you have to hire the garbage service and the truck to drive it away before you hire the guys to come pick it up off the curb, before you put it out on the curb. Because if you just put it on the curb, it's just going to rot and affect everything around it. So that's kind of how I explain like the waste system to people, which is how this definitely also affects men, especially in the liver. And the adrenals, everything that we're talking about there, all affects all of us. But for this, I also wanted to dive in a little bit to how this really affects cardiovascular health as well, which is definitely how it affects everybody. But I'd love to talk a little bit about that, and then we can dive into what can kind of happen down the road as we begin to age and our hormones are transforming, and why addressing these things early and understanding that, like, if you're having any kind of gut things at any point in your life, if you can address it early, it's so protective for your brain, your cardiovascular system, because none of it's separate. So I'd love if you'd touch a little on the cardiovascular component, because I know you're quite knowledgeable on that.
Yeah, nothing is separate, and you're correct. And we can certainly address men too. I am board certified in integrative medicine, so I do see men as well.
Fantastic.
It naturally kind of comes up that since I'm an OBGYN, it sort of attracts more women to talk. So if someone has a question related to men, I can certainly answer that as well. But it's the same. They have estrogen, they have testosterone. It still has to be the symphony that has to correlate. And we know that certainly hormones, sex hormones that are off will cause blood sugar issues, will cause cholesterol issues, will cause inflammation issues. So it's the same kind of interplay that's important for metabolic health. For cardiovascular health, I would say, this is really important because I think we don't think about heart disease or heart issues until someone's like 40, 50. I mean, in fact, in traditional medicine, right, we don't even test for anything. You don't even get an EKG until you're over 40 if you need surgery, or you get your cholesterol panel at 40 or 50, depending on which the doctor recommends. But really, this needs to be addressed. You need to be looking at this at 20, at 30, at 40, at 50, right? You don't want to wait until you start developing cholesterol issues or hypertension issues or those things. It's much better to have followed it here. So I'm a big advocate of actually getting lipid panels earlier, especially if you have PCOS, because you basically have metabolic syndrome, right? And I always I do an advanced cardiac panel or cardiac IQ, however you want to. Depends if you're using Labcorp or Quest, whoever you're using.
Which includes things like homocysteine, which I feel like a bunch of people don't check, which is really important for protecting your cardiovascular system and making sure you're detoxing your hormones properly.
Yeah, so it includes more important details about, what we tend to talk about is like LDL, the bad guy, HDL, the good guy, right? There's no sort of like bad guy, good guy. It depends on, well, obviously if you have like very minimal HDL, you should probably fix it, you need to up that to be the good guy. But in general, to sort of categorize things and say something's bad and something's good isn't necessarily correct.
I also just want to point out to anyone listening, she just said that your LDL can be too low. This is a real thing. And I think everyone only thinks about it being too high, but it can be too low. And it actually affects your body's ability to repair your cells. So that's how I look at cholesterol, is it's your body trying to repair cells. So if it's out of range, rather than only trying to mute the cholesterol, ways that integrative medicine thinks about it is we need to figure out what your body's trying to repair. So I wanted to highlight that because I think that's a newer fact for some people.
Yeah. So an advanced panel will really tell you, do you have inflammation issues? What are the size of the particles, the LDL particles? Are they big and fluffy and kind of bounce through in the blood vessels? Or are they small and dense and want to like stick in the cracks in the sidewalk, right? I think it was Peter Attia who had this great example, and I may be incorrect, but about sort of a sidewalk and a crack in the sidewalk, and how if you have these sort of cracks that develop as we age, and you have these small little particles, they're going to want to stick in those little cracks. And then you have inflammation, which is like the glue that makes that little plaque that kind of puts it together. So versus like these fluffy big particles that don't really get stuck in the cracks and they move on in the blood system, and it's sort of less of a risk than someone who has these smaller dense ones. So understanding and this theory is really looking at basically, because we know there are people who, if you look at the studies, like there are quite a number of people who have heart attacks who have completely normal cholesterols, right? Completely, they would not even make anybody's blood pressure go up in medicine, and yet they're having heart attacks. So it's more than just LDL, the component. You need to actually understand what are those other markers, cardiac markers. Does someone have inflammation, the glue that's sticking things together? Do they have other components in their health that are putting them at higher risk for heart disease, i.e. menopause for us as we age, smoking, obesity, all those other risk factors that come in there. So it's more than just that. One thing that a lot of people don't actually realize is like as we actually do age and we lose sex hormones, our cholesterol goes up. And our total cholesterol goes up because the building block for sex hormones is cholesterol. So it's very normal. Someone comes into my office and they're 50 or 51 and they go, what the heck happened? I have not changed anything I ate or nothing. I'm healthy. And why did my cholesterol go up? And I said, well, is your estrogen like 10? Sure, estradiol, I should say estradiol because there's more than one, but estradiol 10, then, this is probably related to the natural course of what happens as we age, is that if our ovaries are not capable of making estrogen, they're going to say, I'm just going to store all the building blocks. I'll just store all the bricks. At some point, someone will make the house. But if I store all the blocks, maybe someone will come in and make the house, but unfortunately the workers are not going to work anymore. The ovaries, they're not going to build the house. So it's important for us to not wait until those timeframes. It's important for us to understand what are our risks as we're in our 20s and 30s and 40s, especially if we have chronic medical conditions like PCOS or other high metabolic syndrome kind of issues that we're keeping on top of that early, and that way we don't end up sort of in our 50s dealing with high blood pressure, high cholesterol, high LDL. Someone wants to put you on a statin, like that whole scenario that typically happens.
So I would love to touch on that a little bit before we go into our next question. How do you approach with men or women in your practice when they do have high cholesterol? Because also our standard levels of cholesterol changed at, a certain time in our history. They used to be it used to be allowed to be higher, and now there's a lot of efforts, of really watching cholesterol, but forgetting all those other pieces of the symphony that we were talking about. If someone came into your office, like what would you consider, high levels, or how do you approach those scenarios so that you're, optimizing their cardiovascular health along with their hormones?
So I do want to make sure they got that cardiac panel, a more advanced panel, to understand what's their lipoprotein B, what's their PLC, what's their LDL size particles. Like I want the more extensive cardiac panel. Now, I should say that if if their cholesterol is like super sky high and their LDL is 200 and their HDL, there's some also parameters, right? If they're very, very high, you have to be careful of making sure you understand how much time it's going to take to do things more natural or a little bit slower. So some of that has to do with time frame too, right? You don't want to keep someone super high and have them at high risk if it's going to take them 6 months to sort of sort the puzzle out.
But you were saying LDL at 200, not total at
Not
200,
total.
correct?
Yes, yes,
Yeah.
yes, yes. I'm sorry.
No,
LDL
no, no.
200. Yeah.
I'm just pointing out like these little pearls that you're giving to everybody
Yeah.
listening, because I think these are some of the really confusing components around this. And she's making some really good points. So thank you. Please continue.
Yeah, so the context of who you're talking to is important. If it's, again, a 49-year-old male who's coming to me saying that I suddenly have these changes in my cholesterol panel, but I'm not doing anything different. I eat really well, I exercise, what is going on? Then I'm going to be like, what's going on with his sex hormones? What is the issue related to his sex hormones? I'm going to look at the bigger picture of what could have changed. But and often with women who or men who were giving them HRT anyway, I will do that first and then recheck them, right, months later, to see was that little slight change of their bump of their total and their LDL related to the fact that they're now needing to restore their sex hormones. But in general, if we're just looking at that, I do want that advanced cardiac panel. I do want to know their inflammation. So CRP, we didn't even talk about that yet, but CRP, incredibly important to understand.
Feel free to dive into that.
Yeah, what their inflammation level is. Also understanding maybe there's some lifestyle changes that they actually haven't even been talked to. Because if you ask your doctor and they say, oh, your cholesterol's high, your LDL's high, I want to start you on a statin, they almost always say diet, right? Diet and exercise, almost always. I feel like I could wager that in Vegas if I had to, that they're going to say that to you. But sometimes it's a matter of like, a lot of times it's a matter of actually diving into those questions with the patient. Well, what do you eat? When do you eat? What kind of exercise do you do? Because if you're putting yourself in a situation where you're eating a lot less and you're exercising way harder, that cortisol is not helping you. That cortisol is working against everything you're trying to do. So that's the ding, ding, ding elephant in the room we need to address specifically. So it's a matter of, this is why whole body medicine or integrative medicine, like what you and I are preaching, is really so important, because it's not this little piece of you have high cholesterol. It's a piece of the bigger puzzle. What's going on in this person's life? What are the other things that relate to it? Because I've certainly seen patients who have been told by doctors that they do everything perfect. They're eating 1,000 calories. They're working out 4 to 5 times at the gym. They're doing all these things that are kind of like, but yet they have horrible CRP that's super high. They have nutrient deficiencies. They have all these things that are throwing off their other labs. And so you have to sort of see the bigger picture.
Yes, Absolutely. And she's talking about CRP, which is kind of an inflammation marker, and you can have normal CRP and still be inflamed. And so it's also
Mhm.
helpful to like compare it with other markers like ESR and doing more functional tests that look at like how inflamed is your gut actually. Because, we're talking about HRT as a component of helping cardiovascular health along with the lipid panel. But in the beginning, we started with the gut, right? So
Yeah.
that's still the thing that you need to start with, that diet and exercise for sure. But exactly like you're saying, like, well, how are you exercising? Because if you're over exercising when your adrenals are depleted, you're just depleting your system more. But there's other interesting blood markers, and like everyone knows, like hemoglobin A1C for blood sugar. Totally. But if I see a high hemoglobin A1C and a pretty normal blood glucose and insulin, I'm starting to look for toxic exposure
Hmm.
and see, which can totally affect your cholesterol, right? Because your body is trying to repair whatever's being damaged by the toxic exposure. And people forget about those things. And it can just be from like a slow water leak in your house that you didn't know, and all of a sudden there's mold, or from working some job where you're around weird chemicals all the time and it's really hard for your body to detox. And I saw someone say earlier, like, make sure to replenish your minerals. And like, yes, we are all so mineral depleted these days, and you need minerals for all of these reactions in your body. So there's so many symphony pieces to look at for all of this. So if you're going to your doctor and you're relatively healthy and they immediately want to suggest a statin, which totally has its place in certain scenarios like we're discussing, just ask about these other things. And that's why she and I wanted to do this, is so that you can ask educated questions and be an advocate for yourself. Because I think people forget that doctor means teacher. So we want to teach you how to understand your body and how to ask questions for your best interest. So, oh, that was beautifully stated. Thank you so much. And I think,
Yeah, make sure that they definitely are doing the lab. I mean, I think if they say, yep, here's your LDL's too high and I want you to start a statin, okay, make sure that they're doing a more advanced cardiac workup. Like, who am I truly at risk of cardiac disease or cardiovascular disease? Am I the one that's in that statistic, the little 4 boxes in the right corner that says inflammation, LDL particles, lipoprotein B high? Like, am I the one in that category, or am I sort of the general audience that statins are recommended for? Because we do know I'm not against statins. I certainly use them, but I do know that, we can't just sort of put everybody on a statin just because their LDL is elevated. It needs to be a more comprehensive approach because there's certainly side effects. And we know long-term risks are high and so we need to sort of make sure that we're putting the people who are truly at cardiovascular risk on them, and that we're not missing the other components that could be addressed and maybe will actually make their numbers look better.
because also, if we can address those other components, they might be able to get off of it, which would be the goal, right? Like we should be using it to protect them, but maybe not necessarily as a complete solution, because there's usually other stuff going on. Plus, one of the weird side effects is that it can cause some metabolic blood sugar issues and lead to, things like diabetes down the road, which then can turn into type 3 diabetes and brain health effects in our later years. So if we can really address this stuff early in like our 30s and 40s, your 50s, 60s, 70s, 80s, you're going to be a lot more functional. So let's dive into like kind of as we go into those, 40s, 50s, 60s years, especially for women. And like men, you have your own hormone fluctuations, but women, we just have to deal with the significantly massive effect of it. So let's talk about how all this kind of plays into like the perimenopause area and like what people might experience depending on their state, and then how that kind of bleeds into menopause later.
Sure. I think one last thing I want to say about statins
Oh,
is that
sure.
if you're on statins and you have some vulvar symptoms, then honestly, there's a lot of linked vulvar issues related to statins, not just itching, but like lichen disease. There's a lot of sort of, people don't correlate those a lot, but as an OB/GYN, I see them quite a lot. So I would just say, make sure you have a conversation with your doctor if that's something that you're experiencing. It's definitely at the very, very, very fine print at the bottom of the statin booklet, and I think it's more common than we think. And so I certainly would suggest, if you're having some sort of vulvar symptoms and on a statin, you need to have a conversation with your OB/GYN about that.
I think that goes for a variety of skin issues, right? Because skin is endothelial tissue,
Yes.
gut is endothelial tissue, blood vessels are endothelial tissue. So if you're having skin issues, it probably means you're having issues with your other endothelial tissue that need to be checked out. So I think that's a very good point. Skin is so telling about the entire body. Like if you have skin stuff going on, there's usually something else to be addressed. So beautiful. I like that
Yeah,
caveat.
I just like to say it because I think that's something that people don't talk about. That's something that's often like kind of women will say, I feel uncomfortable even saying something, or I don't even know who to talk to about it. And so I try to like put up those things that I know people really are may be affected by, but not really actually open to say. So that's why I brought up that specific thing. But you're correct. Skin for sure everywhere on your body is an issue.
Definitely. And I know, again, we just had, a couple questions from people being like, how does this affect men too? Any last comments you want to throw in about the role that this plays for them and how it can be a little bit different before we move into the more women-focused area for like menopause and perimenopause?
No, I mean, I think that for men, again, making sure you get an advanced cardiac panel, looking for inflammation issues, finding out what is the percentage, what is the actual chance for me, my own personal biology, that I'm going to be at risk for cardiovascular disease, and is the statin the right medication? I think that applies to men and women both. It's not just for women, but I think it's important to understand that component. And certainly with men, I would say the other thing is, testosterone, right? Testosterone levels often are ignored or not checked, and that can be a very big component. We're talking about cholesterol, specifically understanding where does someone's testosterone levels for men, because too low can be a problem. Again, storing cholesterol, wanting to keep cholesterol to make testosterone. And certainly if you're on supplements or things that are making your testosterone super high, that can cause an issue as well. So making sure for men that if you are getting your yearly blood work and it comes back with your LDL that's elevated and they're making a suggestion of statin, I would say, hey, doc, did you check my testosterone? Has that ever been any of these hormones been checked, to make sure you're really getting a decent workup for that too?
And checking your inflammation, checking your gut, checking your toxin exposure.
Mhm.
Beautiful. Thank you so much. Oh yeah, go
Yeah, I
for
mean,
it.
yeah, toxin, will probably be something outside of Western medicine because they typically don't think about those things. But, and we haven't even really dived into the many, many, many functional medicine tests that are fantastic for a lot of what we're talking about. Because I was trying, I think sometimes starting with the mainstream helps a little bit better for people, but your audience may be like super gurus with functional medicine testing. But certainly, if you do think there's a toxin exposure, you're going to have to see a functional medicine or integrative medicine doctor, because they just don't do that in traditional medicine.
Yes. And I know everyone's like, but it's not covered by insurance. And I'm like, well, sometimes paying a little bit out of pocket to not have your insurance cover your hospital visit later is worth it. So, anyway, coming into kind of down that timeline as we start to age and come into, our 40s, 50s, 60s, what do you recommend for people along this whole pathway that we're talking about, the metabolic health, coming into affected hormones, and how that can lean into having an uncomfortable perimenopause or menopause, and why some people get hot flashes and some people don't have as bad hot flashes, and how these symptoms differ based on what's going on chemically.
Yeah, so well, perimenopause specifically, it takes 10 years. It's typically a 10-year time frame, right? And we have stages of perimenopause. So the definition, just to remind people, you guys probably know this, but menopause is 12 months without a period, right? 12 months in one day, like balloons start falling down and rainbows come out. You've made it to menopause. But before that, we think perimenopause is like a 10-year transition, and it's certainly people go through stages. And it's related to what happens with your hormones. So as your ovaries are not making progesterone in the first sort of stage, because you're not ovulating consistently, then that progesterone starts to decline and decline and decline over that time frame. And then you start noticing progesterone type symptoms, dominant symptoms. So difficulty getting to sleep, staying asleep, edginess, anxiety worsening, sometimes very low mood that can happen as well, hair thinning, um, difficulties sometimes with joint pain can be progesterone as well. So you start noticing those progesterone type dominant symptoms. Perimenopause, the difficulty is that when estrogen starts to decline, it doesn't do this nice little gradual, it's like a roller coaster. So it goes all the way down. This is why a lot of doctors are discourage women from getting blood tests, because they say, well, and it's true, like if you get your blood test drawn, your estrogen, maybe your estradiol may be 200 one day, and then 5 days later it's 60 when you measured it. It may be really off because of that sort of constant up and down motion. I don't discourage people from getting blood tests. Sometimes they can be very informative, or something like a Dutch test can be very informative as to what's actually happening with your hormones.
Which has to
But because
be done during days 19 to 21 of your cycle, by the way. So if
yeah,
you want a good reading of your hormones, they need to be done in that time frame.
yes. So it makes it a little more complicated for people who've had ablations or an IUD, and then you have to use, ovulation tests to sort of get an idea where you are. But, because those things are a gradual change over that 10-year, theoretically 10-year time frame, this is why perimenopause symptoms, people experience things very different. It may be that my progesterone went down and now I can't sleep and I want to kill my husband. Like, I hate everybody. I don't like coworkers. Like, I have those sort of symptoms. And there may be somebody who's the same age as me that's actually have a declining estrogen and progesterone, and so they have horrible hot flashes or night sweats or brain fog, or the inability to kind of get things done, focus is off, their joints hurt. Those, and so it can be a very different journey for every woman. And when you have these declining hormones, like we've already talked about, is then it affects your blood sugar, it affects your insulin, your ability of insulin to do its job. It affects the ability of, those wonderful hormones, leptin and ghrelin, that tell us don't eat, we're full, or we're hungry. It affects that communication in the brain that says we should stop eating. It affects our gut health because, again, those estrogen and progesterone have to be effective. So oftentimes women in perimenopause say, I'm getting bloating after I eat. I'm getting constipated. I have these sort of I've been diagnosed with IBS. These sort of GI symptoms that happen. And then certainly if you're not making appropriate neurotransmitters, then you have mood and anxiety issues as well. So it kind of all interplays because of this declining overall sex hormones that are made from the ovaries. So it can look very different to different women. And so I try to, when we talk about sort of treatment, we also talk about what symptoms someone is having, because that drives the type of options that you discuss with someone. Because if they're someone who has minimal progesterone, then we talk about progesterone sort of options, or if they have progesterone estrogen issues or testosterone issues, then we need to sort of address it from that standpoint. What is the hormones that are needing to be restored?
Yep. That was so well said. And, all of us, men included, start to decline in hormones as we age. And then this kind of brings us back to that adrenal component, where if we're pushing our adrenals super hard, our reserve tank is low for being able to replenish our hormones. And for women after menopause, that's where a lot of our hormones come from, in addition to our fat tissue. And so depending on your status with those, it can also really affect your hormone production. And I'd love if you have any additional thoughts around just kind of like the role like the HPA and adrenal axis plays. And then I loved how you were commenting on like your insulin actually doesn't work as well when these hormones are low. So if you could kind of explain those, and the leptin ghrelin, which is basically like food cravings for people. I just think that's a really valuable piece of information.
Yeah. So related to adrenals, cortisol, what's a good example? Like cortisol can just derail everything. Like if you have
Let's say you go
cortisol.
classic thing. Let's say you like go through a really stressful thing, like relationship ending or losing your home or losing a job, and then all of a sudden your cortisol skyrockets and you get really fatigued, and then all of a sudden your hormones are messed up and your gut's messed up and you don't understand why, as an example possibly.
Yeah. So certainly, if you've ever had a Dutch test and looked at a Dutch test, it has a beautiful diagram that explains sort of how cortisol on this corner over here, your adrenals, um, you know, we make testosterone from our ovaries, but we also make testosterone in the adrenals. And so, and you have DHEA made from the adrenals. So certainly these components can, if you make testosterone and then you convert it to estrogen in peripheral tissues, then you can imagine you can throw off this system over here if this system is out of control. So if this system is like super high, cortisol's high, DHEA high, making more testosterone, that testosterone is going to be driven over and affect your sex hormones ultimately. So, and the same way it can go the other way, right? Really low cortisol, you've burnt them out. I mean, there's no, in medicine, we don't say adrenal burnout, but you know what I mean? And you sort of like have burnt the wick too low. You also have that same problem because when you have low cortisol issues, the body goes, well, hey, how do I get more? Why don't I not make these guys over here, and I will push over here and I will make more cortisol because really, if I need cortisol to survive, I don't need to be making babies over here. Like it's no, there's, we're in this sort of, we're rigged for sort of reproduction, right? But if I got stuff to do because my poor body needs to survive, I'm not going to be interested in having babies and making babies and having cycles because I don't need to. I got to survive. So it can be the other way as well, where it's lower, where you're dealing with low cortisol issues versus elevated cortisol issues. So that system can completely throw this system off too, which is really important when we talk about when someone gets tested, when they are having what they feel is a hormonal balance. You can certainly test sex hormones, but if you don't at all address cortisol or even just have a discussion about that may being a factor, you're going to miss a big component of how to fix those problems. So I think that, that's definitely something that in Western medicine, cortisol is not, it's rarely tested, and there's very limited options for testing. So functional medicine testing really is valuable with saliva testing, or Dutch test can be very valuable for someone who's experiencing those symptoms for sure. And I would say I'm almost always, when I see someone who's 40 and above, like I said, we always look at it from a metabolic standpoint and say, you need a CRP, you need a cardiac panel, you need homocysteine level, you need a vitamin D, you need a vitamin B12, you need your sex hormones, like you need a big picture, and cortisol can be a part of that component as well of looking at it.
Absolutely. And then I know you're mentioning a little bit around like hormone effects on insulin. I'd love if you just kind of tie a little bow on that one for people.
Yeah, yeah. So what happens in perimenopause and menopause, sorry, I hope that thing popped down.
Yeah.
What happens in perimenopause and menopause is when those estrogen levels, again, like I mentioned, estradiol is like the bossy person. She's sort of involved in everything. So when you have declining estradiol, then you don't have that boss that's sort of reminding the cells, please pay attention to insulin. Please, insulin's telling you to bring glucose into the cell to make energy. Here's the mitochondria, back to your mitochondria. And and so if you don't have that person who's sort of like the traffic controller saying, yep, let's use it. So I always explain to patients, like, we're using it or we're storing it, right? We're using things in our glucose or we're storing them. We're doing one or the other. We're typically not in this sort of wishy-washy state. It's like, we need it, we're using it, we're making energy, or we're storing it. So when you have this sort of cell that's ignoring the insulin signal, you get insulin resistance, which ultimately then starts to cause pre-diabetes issues, and then ultimately ends up with diabetes long-term if it's left unchecked. And so that without having estradiol kind of reminding, like, hey, you need to use it, then we're going to have that insulin resistance goes up, which then you're going to store, which is why women get these, and men get that lovely storage, which is typically in our, bellies, mid-abdomen, or faces, or, behind your arms, or thighs. Those are typically the sort of more storage locations for us. And so you need estrogen to be a part of that scenario to help, for lack of a better word, boss that hormone around to say that it needs to happen that way. And when you have insulin resistance, then you also have that dysfunction with leptin and ghrelin that say, hey, brain, we ate, we're good, let's stop eating. You have this, dysfunction that occurs because they don't have the ability to, doesn't have the same ability to say, we ate, we're done, stop, or we're hungry, we truly should eat. It sort of throws that off as well when you have insulin resistance.
Absolutely. And with these like weird hunger component things, that and insulin and our hormones can also be affected by toxins. So especially if you're in like
Yeah.
some of your younger years and you're dealing with this, it may mean that you need to get checked for some environmental toxins, which is, like one of those panels we were talking about. And in functional medicine, we have a lot of different panels. I'd say some of the really common ones I use for people are, I love looking at salivary hormones. I think conventional medicine tends to look at blood, and salivary can be a lot more telling about how your body's using it. And I like to look at adrenals at like multiple points throughout the day. So you see this nice curve is like what it's supposed to be like. And then understanding that if you want to look at how you're actually metabolizing your hormones, which is super important for breast health, then it's important to look at the urine component because it tells you like how you're breaking it down and how you're processing it. And, I saw a comment earlier of like, okay, we've talked about all the problems, like, how do we address it? Kind of goes back to what we were talking about in the beginning of like, it really, a lot of it starts in the gut. A lot of it starts with what you're putting in your mouth. A lot of it also starts with how you're managing your thoughts and your stress levels. So if you're looking for natural ways at home to work with this stuff, really look at your food, really read your labels, make sure you're not accidentally ingesting toxins. Check your home and environment for toxins, whether that's in your personal care products, your cleaning products, or just like checking crawl spaces or looking for bubbling paint or weird things that might be mold or organisms growing in the home, and just starting to really take care of your environment and becoming more aware and noticing these things. And when it comes to like basic exercise things, if you are one of those people that just struggles with regular exercise, if you can make a goal for yourself of going for a 15-minute walk at sunrise and sunset, it has almost as many benefits cardiovascularly as running. And if you do it at sunrise and sunset, that light change without sunglasses will actually start to reset your circadian rhythm and reset your hormones. And these are just the simple things that you can do at home. Throw some meditation in there and mindfulness and practices like yoga that allow you to kind of enter that meditative state. This also starts to balance your hormones through balancing the cortisol pathway that we were talking
Mhm.
about. So those are just some basic tips. If you're struggling with deeper issues than that, then that's when you can seek a functional medicine doctor like Dr. Rollins or myself, and we'll go through these things with you and help you figure it out. Because I think this leads beautifully into the next question I have, unless you have any additional comments. But what do you think is the biggest hurdle in maintaining our health today for people?
Um, wow, that's a good one. I think habits are sometimes hard to change, and maybe that's because I'm reading Atomic Habits by right now.
Oh,
But
great
I
book.
think this is the second time I'm reading it. But I think we get into these sort of usual habits, and we sometimes it's hard. I think this time of year everybody's always thinking like I should eat better, I should exercise more, I should take care of myself. But it's really easy to sort of fall back on our habits. And I think the changes that truly sustain are the ones that you make them part of your life, right? So that you make them, it's an easy addition. It's just like another habit. It's like when I brush my teeth at night, I do this. Like it's the ones that are really sort of not an overhaul is the ones that are really these small changes make a big difference. And so trying to really think about, so here's an example. Here, I'll give you my laundry list. My one, in my 40s, I realized that I couldn't have my 1 to 2 glasses of wine every night. I had built up this habit. I was a stressful OB/GYN who was working 80, 100 hours a week, delivering thousands of babies. And so
Thank you, by the way.
I use this crutch of having a glass or two of wine when I come home because it was like decompressing. And so it was a very hard habit for me to let go of. And I realized it was just because I had like put this in my daily thing. It wasn't like I was, oh my gosh, this Sauvignon Blanc was the best thing I've ever had. Like it was just, I had this habit of doing this.
It's like a
And
ritual that's comforting.
it was a ritual, yeah. And I had to sort of like really think about it and go, well, actually, I think I just use this to chill out, to de-stress. What else can I do to stop feeling that way? So you have to sort of look at what is the reason behind things. And I often ask patients when they say, well, I want to lose weight. And I'll say, why? Why?
Hmm.
Because the why is far more motivating than the losing weight. I want to run around with my grandkids. I want to get into skinny jeans again. I want to just look good in the mirror. It's the why. That's those things. For me, it was the why. Why am I using this? I'm using this because I feel stressed when I come home and I need to just chill out. Well, what else can I do? So, there was, and so actually, luckily a dog is very helpful because they have to go outside and get walked. So I'm like, hello, I need to take you out for a walk. This is what I'm going to do now when I get home. I'm going to, walk right in the door, take the dog, and then this is going to be my glass of wine. And it was far easier when I sort of looked at it more of like, don't do this, Jen, don't do this, Jen, but what can I do to figure out the why I needed to have this? So I think habits are the hardest things to really kind of change, where you have to sort of look at what is it that you can add to these things that will make them healthier habits than sort of an overhaul, if that makes sense.
I love that you ask the why question. I think it's one of the biggest things that gets missed in healthcare. And you're going to be significantly more motivated to do stuff if your why is something like, I want to be cognitively healthy enough so I can play with my grandkids. versus either one of us telling you that you should do it because the research says so. So if you can tap into that like deep why, whether, male, female, whatever, like I think it is a huge component of making it sustainable. And I like your idea of replacement. So like I used to really always get sweet cravings in the evening, and it was just like dark chocolate was my Achilles heel. And I tried really hard to replace it with just like some tea, like some chamomile tea. And chamomile, if you don't steep it too long, is actually kind of sweet. And so it's like, and then that preps you for sleep as well. And then you're not like consuming caffeine before bed. And the like alcohol, like we were talking about, I think what she was saying is super, super common for people. And like essentially the brain healthy amount of alcohol these days is considered to be about 2 glasses of alcohol or less per week. I think that's a really good thing for people to aim for. So if you're doing more than that, consider, and for me, it's also like, I just want to feel fancy sometimes. So if you really like having a wine glass, put some sparkling water in it with like a dash of juice and just drink from the wine glass.
Yeah.
And so there's little ways to replace those things like that. So yeah, I think the habits thing is, I actually agree with you. Like if I had to come up with the same answer to that question, I think I would agree that that is the toughest part, is changing habits and becoming aware of them, which is why we're talking about this stuff. Like we just want to bring some awareness into your life, and we don't expect you to change tomorrow, but if you can think about this multiple times, then that's how it kind of all adds up together. So beautiful. And if people wanted to learn more about you because you have so much good information, or wanted to work with you, where would you direct them?
So I have a telehealth practice, but I'm obviously a physical location in California, in Southern California, and I do IV therapy also. So I expanded into IV therapy. I do elite physicals. So when I was talking about more comprehensive physical, I really, I do like a balance test and a brain scan. And like, I really try to promote a much healthier assessment for a yearly exam. And I do that covered by insurance, IV therapy covered by insurance. In Southern California. But if you're outside of California, I'm licensed in 12 states. So I see patients in Missouri, Montana, Arkansas, Minnesota, Nevada, Washington. I'm sure I'm missing some other ones. But anyways, you can go to my website. So I have a website, WellWomanMD, WellWomanMD.com, or certainly I'm on Instagram at drjen.md. And I really try to promote preventative medicine and reversal of disease. So that's really where people can find me and try to, be part of this and change the face of medicine, right? That's what we're here to do.
Absolutely. I think you are changing it by providing those services and doing that kind of annual physical, which I think should be done everywhere, and figuring out how to make that work in the insurance model for people. So thank you
Sure.
so much for taking the time to do this chat today. I think that was invaluable. And we covered so many important, confusing hormone pathways for people. And, I know we used a lot of scientific language, but this will be recorded on my channel. Feel free to go back and listen again. Please share with your friends. Like we do this for you guys. We just want the education to get out there, and for people to feel empowered around their health instead of disempowered. So yeah, just thank you again. Any last comments you want to share with people?
I think the most important thing is that you are your own doctor, right? You need to advocate for yourself. So if you are being told your labs are normal, but you don't feel good and something's wrong, find the right person to help you. It's important to find the right chemistry, find the right person that's going to help you understand what is really going on. Because traditional medicine, we typically don't dive deep into these things. So you might have to go outside of that system. But there are plenty of people who are competent and happy to try to help you figure out what's going on. So be your own doctor. You're the one making the decisions. Make sure you advocate for yourself to get what you need.
Yes, and you can shop. You can shop around for a doctor just like you shop for any other professional. Find someone that you resonate with. And if you ever feel like someone's making you feel dumb for asking questions, find somebody else. Find someone that makes you feel empowered and heard and held, because that's what we're here for. So thank you so much, Dr. Rollins. This was an absolute pleasure, and I look forward to chatting again in the future.
Thank you again very much. It was wonderful and an honor to be here.
Absolutely. Have a great rest of your day, and
Thank
talk soon.
you. Bye.